Hello, I'm Michael Perry. Welcome to my website and thank you for joining me. I have been around dentistry my entire life. My father was a pediatric dentist for 44 years, starting in 1950, and I have an older brother who was a dental practitioner in the Puget Sound area. If you look at the dental marketplace in my father's time, particularly in his early years, those were days when my mother was his office manager and sat behind his front desk and would slide back the glass panel that was common in dental offices in those days. The transactions were between patients and the doctor. There was no dental insurance, and people oftentimes didn't even know the cost of the treatment before the treatment was rendered. Very simple system. Today, academics might call that a linear system. The interests of the dentists and the patients were aligned. In the mid-1950s, the CDS, the California Dental Service, which today is Delta Dental of California, came into the marketplace, and the systems for payment were changed forever in dentistry and have been evolving ever since. In the mid-1960s, the vast majority of dentists were contracted directly with Delta Dental of California. Most of them were doing better financially because the third-party insurance was paying for a large percentage of most treatment plans. And I think at that time most dentists were in favor of dental insurance and the idea of third parties paying for dentistry. That was a notion that I think most dentists favored at that time because it allowed them to do their best work on a regular basis and get well compensated for what they did. If we fast forward to today, we have a very different dental marketplace. Some decades ago, the fee schedules, the pricing that dentists deal with in charging for their services, the control of that pricing had largely gone away from the dentists themselves and was now controlled by the insurance companies. As the insurance companies competed with each other on the open market, the incentive was for the insurance companies to have lower premiums. In order to have lower premiums, they had to pay the providers, the dentists, less and less. So in real dollars, we've seen pricing for dental services diminish, and we've seen the profitability for many private practice owners diminish over time as well. If we couple that with the increased cost of a dental school education, we have a marketplace that is much more challenging for dentists, particularly younger dentists. And dentists need to understand the business of dentistry and to be able to compete in the marketplace, in my opinion, exceeds anything that existed in the past. I have dedicated myself in the last 20 years to teaching dentists about the business of dentistry. My overall goal has been for dentists to, on a regular basis, be able to do the best they can for patients while always acting in the patient's interest. And my belief is if that is going to be a core principle and a tenet of our profession, that we need to have the majority of practices, if not all practices, owned and managed by dentists themselves. For that to occur, my colleagues are going to have to be better at the business of dentistry than my father was in his time. Please take some time to look at the website, look at the resources that are available, pay special attention to the Developing Webinar Project, which is a training program available for all dentists on this website. Thank you again for checking in with me, and I look forward to seeing you at a future training.